Hello, everyone. I'm waiting for Instagram to do its thing. There we go. All right. Admittedly, I do not have the best Wi Fi out here and I do not have it hard connected, but I am being stubborn today. I wanted to be outside. So I am outside. It's a little dark here because the background light is making me look darker, but it's okay. All right. We're talking about hot flashes today. So I have my little cooling necktie here. These actually work really well. If you've never tried one of these, you see these like all over the place in the stores. You just get it wet or you leave it in the fridge or something. And it actually really, really helps. So there is that. Also staying in the shade and of course staying hydrated. So we're going to talk about hot flashes and why they get worse in summertime for those women who are going through perimenopause and menopause. Hot flashes affect anywhere from, it depends on which study you're looking at, but minimum of 20% up to 80% of women will experience some type of vasomotor symptom, which are hot flashes, night sweats, and of that nature. So, and it can run the gamut from mild to very severe. The concern is not only is this disruptive to your life and your sleep, which leads to issues, but also it is a risk factor for worse risk of heart disease and osteoporosis. So it's definitely something that we want to address. It's not just for your immediate discomfort, but also for your long-term health. So let's go ahead and dive right in. So first, let me introduce myself. I am Dr. Nicole Smith. I am the founder of Anti-Gravity Wellness. Man, my signal looks terrible. I founded this private practice about 3 years ago. Actually, we just passed our 3-year anniversary last month. And I started off with more just like coaching, nutrition, fitness, men, women, old, young, didn't matter. But as I progressed through that and started incorporating things like functional labs, was really finding that women in particular, and women in my age range and older, were suffering from a lot of issues with hormonal imbalances that we were finding on their labs. And they would go to their primary doctor and not get the help that they needed. They kind of just brushed off, oh, you're too young for anything to be really wrong. We don't do hormones, or they're not safe, or, just various things. Here's a birth control pill, that type of thing. So, and even I had some problems in my early 30s that when I actually went to a primary care, I went to OB, and they really did not help at all. And in fact, kind of just got told, well, your labs are fine. But when we dug deeper with functional labs with a naturopathic doctor, started to find that there were actually some things going on there. Low progesterone, which is very common in early perimenopause. Also a little bit of thyroid imbalance there that was low grade, not like full blown, you're diagnosed with Hashimoto's, but it was trending in that direction. As opposed to the standard, let's wait and see what happens. We know what's going to happen. If nothing else changes, guess what? We're going to continue down that road. So it's so important that we're actually taking that into account and making sure that we're being actually preventive in our medicine as opposed to reactive. And that is why I founded my practice. And a big part of what I am a huge advocate for and really push for in just general education. But of course, that's how I practice personally. And I use a holistic approach. It's not a one size fits all. I prefer to add functional labs to basic blood work because it gives us more information, but it's really based on what the patient needs, what their budget is too, because a lot of these functional labs, unfortunately, are not covered by insurance. So there's an out-of-pocket cost, and I do my best to source the most economical sources that I possibly can to make sure I keep the cost reasonable, especially when it comes to adding on all of those other elements there. But I wouldn't do it if I didn't believe that it gave us the information we needed to really take care of the person to the fullest extent. And if we're going to do it, let's do it all the way, right? Because long term, it's going to save you grief, your income, your health, your investment in your health. Like, it has huge reaching implications. So that is kind of my backstory about why I founded Anti-Gravity Wellness and how I have come to be here with you now. I will be sitting for the board exam for menopause this fall. Very excited about that. I feel like I'm getting more and more prepared as I go, and just practicing with my patients, and also, of course, doing more continuing education. I've got all my resources too from the Menopause Society. And that's been very helpful to make sure that, I'm practicing safely. That's my number one priority. And then also practicing to the fullest extent of our knowledge and my license here in Washington and Oregon State, and soon to be Idaho. I'm going to be working on that too. All right, so let's meet Sarah. This is our case study client here. So this is not her real name, of course, but she is a real patient. Sarah came to me at age 47. She was struggling with anxiety, broken sleep, and what she described as embarrassing heat surges during meetings and at night. We discovered she was in late perimenopause and started her on a low-dose estradiol patch and oral progesterone, which is kind of a standard regimen. She felt amazing for 2 months. Then summer hit. The heat ramped up, and so did her symptoms. She got in for the same day visit, and we adjusted her dose. That very night, she slept through without a single night sweat. So the takeaway here, when we individualize care and adjust as your body changes, we get very powerful results. Why are hot flashes worse in summer? Here's what's happening. As estrogen declines, the hypothalamus, your body's internal thermostat, becomes extra sensitive. Even small changes in body temperature can trigger a full-blown hot flash. Add summer heat, spicy food, caffeine, or a stressful work day, and it's a recipe for misery. Your system overreacts and says, "We're overheating," even when you're not. So hot flashes are not just a feeling, they're a full body response. Your blood vessels dilate, your heart rate increases, and your body starts dumping heat, often with a surge of anxiety or even dizziness. These episodes can last a few minutes or even longer and come out of nowhere. Night sweats are hot flashes during rest and can seriously impact your sleep quality and your recovery. Why you shouldn't ignore them. This is really important. Hot flashes are not just annoying. Studies show that women with frequent vasomotor symptoms, hot flashes, have a higher risk of heart disease and osteoporosis later in life. So when we treat hot flashes, we're not just helping you feel better now, we're protecting your health long term. That is why I take this so seriously in my practice. So let's talk about some natural cooling remedies that work. If you're not quite ready for hormones, or you just want extra support, even if you are on hormones, here are my top natural remedies. First of all, cooling towels or vests for when you're outside or exercising. Cold water dips, even just your feet in a bucket of ice water helps. If you got a kiddie pool, you're poolside. That totally works. Also, exercising in a pool can be so much better. You don't overheat as badly, especially in summertime. Magnesium glycinate at night helps to calm your nervous system, helps with sleep. Evening primrose oil or black cohosh can be helpful in some instances, but you really need to talk to your provider first. I had a couple of patients that I talked to today who are coming into the programs, and they're saying, I've tried this and I've tried that and found this online and that, and it's not individualized to them. So there's a lot of advice out there, which is great, but it's not catered to you. And so it's important to make sure that you're not just throwing random supplements at it, even if it sounds like yeah, those match my symptoms and that could help, unless you really are versed in that, because you could actually be making some things worse. And I have had that happen with some of my patients that came to me and I was like, that actually was not the right supplement for you. And you're actually making your symptoms worse, which is why you don't feel good and why you're here with me. That's okay. I can help. Adaptogens like ashwagandha can support your stress response, but again, you need to be matched carefully to your needs. Not everyone tolerates ashwagandha. It can have GI side effects for some people. So let's talk about cooling foods and hydration tips. You can also eat your way to better temperature control. Foods like cucumber, watermelon, mint, flax seeds, and berries help hydrate and reduce inflammation. One of my favorite tips is a DIY electrolyte drink. You combine 1 quart of coconut water, 2 cups of filtered water, a juice of 2 lemons or limes, quarter of a teaspoon, pardon me, of sea salt, 1 to 2 tablespoons of maple syrup or raw honey. Mix and sip throughout the day. This is a total game changer. It will really help, and also it's a lot less expensive than buying those fancy little packets or Noon tablets, which I do love, and those are good for travel. So let's talk about lifestyle habits that make a difference. A few daily tweaks can really help minimize symptoms. Strength training supports hormone balance, bone health, and metabolism. Granted, if you look in, like I've got my book here, the Menopause Practice Guide from the Northern American Menopause Society. The research that is currently out there, which of course is, not super robust, something like 0.2%. Oh, I just dropped my book. There's only like 0.2% of total funding from the very little funding that goes towards women's research. Anyhow, that goes into menopause. So keep that in mind. But they haven't been able to find a direct correlation between exercise and vasomotor symptom relief, but it stands to reason that exercise, we know, does help with cardiovascular health. Cardiovascular health seems to be tied to the vasomotor symptom issue that's going on there, and also helps with your hormone balance. So maybe not in the studies that we've looked at so far, or maybe they need to be longer studies. I don't know, but it does stand to reason that strength training, which we know is already imperative when we're aging, it will help with your hormone balance, your bone health, your metabolism, and will also help with your hot flashes in the grand scheme of things. But what we do know works immediately and with more measurable outcomes in the research that has been done are things like breath work and nervous system regulation, which helps to keep your cortisol down, and will also help with your blood pressure. When your blood pressure goes up, that can also contribute to feeling flush, having those hot flashes. Keeping your bedroom cool, we're talking like 65 to 67 degrees Fahrenheit. What that is in Celsius, I don't know. But using fans and wearing light sleepwear, or going without, and just the blankets and the sheets. And you can work your way into this. You don't need to slam yourself into 65 degrees Fahrenheit sleeping if you're used to sleeping with a warmer temperature. But if you're having hot flashes, it'll probably help you. And then that will also, you have to balance that, because a lot of women say that they get hot and they get cold, hot, cold, hot, cold. Because you think about, like, if you have a fever, someone can have a really high fever and yet they're freezing, because from the ambient temperature around them, they're cold. But actually, it's because their internal temperature is so high. We want to skip alcohol and sugar in the evening. They are major hot flash triggers. So that's definitely something to avoid. So it's not about perfection, though. It's about consistency. So just make small changes, what is manageable for you. You're already anxious as it is, girl. I know you're having all these issues. But also, a lot of women are just so desperate for any relief, they will do anything. So these things will help. Okay. So what about BHRT, bioidentical hormone replacement? Let's talk about the most effective treatment for hot flashes. It is BHRT. We're not masking symptoms here. We're actually addressing the root cause, which is declining estrogen and progesterone. BHRT can dramatically reduce hot flashes, improve sleep, brain clarity, libido, and even protect your bones and your heart. And yes, it can be done safely and customized to you with a knowledgeable provider, such as myself. Okay. So, what if you can't take hormones or you don't want to take hormones? That's totally fine. You don't have to. Plenty of women go through menopause and never take bioidentical hormones. So, I want to be very clear that it's not for everyone. But, um, for example, if you've had a hormone sensitive cancer, like you're BRCA positive, you might be told you're never allowed to have estrogen replacement. Although we're finding that's not exactly true. You can have like topical vaginal estrogen for the symptoms of genitourinary syndrome that can happen through perimenopause and menopause because it doesn't actually get absorbed into the bloodstream in the same fashion that like the patch also doesn't get absorbed quite in the same way. The oral pill is the one that we worry about with there's a minuscule increase in risk for blood clots. But if you're a smoker, if you have a history of blood clots, if you have a history or suspected cardiovascular disease, then we're going to err away from that. And the reason why it does that is because it goes through the liver. The patch does get absorbed into your bloodstream and it affects the entire system. So it's got benefits whole body. The cream that we put vaginally really just works localized in that area. And then when we talk about the oral pill, also systemic, but it's that first pass effect through the liver that increases the clotting factors and can be a problem especially if there's already something underlying there. So we don't use that as often, though it is very effective and can be very safe for certain people. And there can be other contraindications, or sometimes the woman is like, I just don't want to do that. That's totally fine. You don't have to. All right. So there are several FDA approved non-hormonal treatments for hot flashes. If you've tried all the other things, cleaned up the diet, working on sleep, you got the cooling techniques, doing all the things, but some women, and it can be genetic, have really bad hot flashes. And it's so bad. We have to do something about it because she's not sleeping. And then she gets anxious and depressed. And that's going to affect her long-term health and her mental well-being. So there are other options. There's things like Veoza. This is a new class of medication. It is a neurokinin 3 receptor antagonist. So it targets the brain's temperature regulation center and has shown great promise in reducing hot flashes without affecting hormones. It's a great option. There's also low-dose SSRIs or SNRIs like paroxetine or venlafaxine, which are often used off-label to reduce hot flashes and night sweats. We can try gabapentin. This is commonly used for nerve pain or seizures, but also shown to help with night sweats, especially when taken at bedtime. And then there's clonidine. This is a blood pressure medication that may slightly reduce hot flashes, though it's less commonly used due to side effects, especially low blood pressure, because that's what it's actually used for, is for high blood pressure. So if we give it to you and your blood pressure is not that high, it's going to make it even lower, and that could be a problem. So, but these are all viable options for women who can't or prefer not to use hormone therapy. The key is to work with a provider who understands how to tailor treatment to you. So is hormone replacement right for you? You might be a candidate if you are in perimenopause or menopause. Your symptoms are impacting your quality of life. You don't have contraindications like hormone sensitive cancers or active clotting risk. So, in my practice, we use comprehensive labs, review your history, and build a plan together. There's nothing cookie cutter about it. So, my number one message for you today, if you take nothing else from today, hear this: you are not broken. You don't have to just deal with it. Mm-mm. just part of aging. I literally heard this today from a patient who's coming in. My doctor told me it's just part of getting older. She's like, but I don't think I need to suffer like this. And I'm like, you're absolutely right. You do not. No. There are safe, effective options, and we can help you find the right one. You deserve to feel good in your body again. This should be a time of reclaiming yourself, finding yourself. Like, have you seen the full group now? We do not care. It's so true though. Like when you get into your 40s, you really start to go, God, what was I worried about? Why was I people pleasing and doing all these things? It's kind of an amazing time. And just at this time, our bodies start to change, and it can feel like a betrayal because you are actually more sharp, more wise, more put together than you've ever been in your entire life. And now you get thrown through this. And it can be very frustrating, especially when you're told that there's nothing that anyone can do about it. Just deal with it. And that's not true. It is not true. So do not give up, my friend. Okay. So if you are ready to reclaim your hormone health, we got two things for you. I have a free 5-day hormone reset mini course. Um, This will help you to discover some root causes of what might be going on with your body, learn what your body is telling you, how to listen to her, and what's normal, what's not normal, and then to kind of help start feeling like yourself again. And it will take you through the basic steps of what I use in my practice with my patients. And then from there, if you need more support, you can book a call with me, or we'll have resources to have you go back to your primary care and say, like, hey, this is what I need, or how do you find another provider that's closer to you? Because I only practice in Washington and Oregon. So if you're outside of that area, then we can't do the nurse practitioner side of services. We can only do like coaching type services. So there are plenty of other providers, though, and thankfully there are more and more of us all the time. This is a huge movement, and I'm very happy and proud to be a part of it. But there are lots of other providers out there, so I'm not the only one. And if you do live in Washington, Oregon, and you are ready for personalized care, or you just want to get on a call with me to talk about what's been going on with you and what I recommend, whether that is going back to your primary care with a specific plan or having me take over that side of your care. I don't do primary care services, but I do the hormones and things like that. So telemedicine, which is great because I have patients all over, and you don't have to come into my clinic to do this. We can sit here on a Zoom or on a phone call and go over everything and get you started, do blood work and do a Dutch test or a GI map, depending on what's going on with you, to help you get to the root causes of what's going on so that we can treat you appropriately and get you feeling better even faster. Okay. So you can check the link for the brief initial consult call. If you comment 123, it will get you a link to the 5-day hormone reset, or on the screen right now, if you have your phone, you can scan the QR code for either one or both of them. You are welcome to them both. All right. So thank you so much for being here. If this was helpful, please share it with a friend of yours who you're like, girl, you need this information. This person is going to help you. Stop listening to whoever that other person is online that tells you to do this crazy stuff. I'm a doctor, and try and make sure that I give you the best, most accurate information possible. And I think that's really important because there's a lot of misinformation out there and a lot of just garbage. So I'm trying to be part of the movement of not doing that. So don't forget to connect with me on Instagram, Facebook, or YouTube at Anti-Gravity Wellness. Instagram is really the best place to get a hold of me in the DMs because their platform is just way better. And then remember, you're not just aging, you're evolving. And I'm here to help you do it powerfully, naturally, and with support. All right, guys, thank you so much for joining me. I will catch you on the next one. Bye.